And I just wanted to share what happened with that and all those good details. So, on Thursday or Friday, this past week, I had a call from a company and it was a phone interview. They were asking me about my LPN experience because I sent in my resume and I answered like their questionnaire. And they did the phone interview and then they wanted to send my resume over to the director of the doctor's office that I applied for, and it's for family medicine. So she got my resume and I had my interview with her today, and she was one of the nicest people that I've ever met. And basically, at this family medicine practice, they do EKGs, they give the vision testing, they do the Hep B series for adults. The youngest patient that they see is like 9 years old occasionally. So I would definitely be able to expand my skill set in this doctor's office. They do pap smears, they do orthopedics, they do just about everything. It's like a mini hospital because they're owned by a huge hospital that is in this area. So I went to the interview, met her, another nurse interviewed me as well to see like what my skill set was, and they both thought that I would be a perfect candidate. So I start my brand new job on April 30th. And it's Monday through Friday, no weekends, which is perfect for me. They do all of the training on site at the job, and they are starting me out at $16.27 an hour, which is actually really good. They also included my CNA experience in that pay, and we get raises and we also get bonuses depending on how well our practice does throughout all the other practices. And they like to do fun things like have bowling night or, just get all the nurses. And I'm also going to be working with RNs and medical assistants in the same facility, as well as secretaries. And it's a practice of, I think, 9 doctors. And I'm going to be working for a very busy doctor. He likes to have everything just go, 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 and get things done and be out on time. And I like that. And I like to not be sitting around, and I told them that. There are 2 offices for the same practice. There's one like upstairs and then one downstairs. I'll be working on the downstairs one unless I'm going to float, which means I'd be working for primarily another doctor, which I told them is perfectly fine with me because when I did OBGYN, I worked with every provider in that practice. So this is nothing new. The whole skill set will be new because it's a whole different type of thing, but working for every provider in the practice, I kind of expect to do that because, not everyone can make it to work every day. Someone might call out and I might need to fill in for that nurse. So I would like to know like what her doctor likes. I got to meet a couple of the nurses that were on, site today doing their jobs. Some of them were in the rooms. Some of the doctors were in the rooms as well. And I also ran into a girl I went to middle school and high school with that was working at this practice. So it was like, oh my gosh, how have you been? It was kind of like a catch up. But I'm super excited because they give testosterone injections, they have narcotics that are locked up, so I'll be administering narcotics to certain patients, and I'm excited because it's a range of care. We have people coming in for what's called a nurse visit, so they're here for just a weight check, blood pressure. Sorry, my neighbor started his car. Weight check, blood pressure check, a flu vaccine during the flu season, or just any type of vaccine that students need for school, like nursing school. And they could also come in for just like a medication check and follow-up. So that's really exciting. And like I said, I'll be learning how to set up the EKG machines. They do perform minor surgical procedures. I'm not sure what types. She didn't really go into in-depth detail about that because each doctor is different. Usually the doctor will say, hey, I want to perform this today, and then they'll tell me what they need for the procedure, and I set up the room just like I did for OBGYN exams, get everything ready and prepped. So I'm really excited. And the good thing about this company that I'm going to be working for, she said, occasionally they will have openings at the actual hospital. So if I wanted to request a transfer for the emergency room department or labor and delivery, mom and baby unit, or whatever unit opens up and I've been there for 6 months or longer, I can request that transfer and they will transfer me over to that department. I don't think I'm going to be doing that though, because just seeing the patients walking in, hello, just seeing the patients walking in and out of the practice while I was waiting for the lady to interview me, I saw a wide range of different people. There was a lot of geriatric. One man had like a walker. And then there were some middle-aged people too. And she told me the doctor that I'm going to be working for primarily sees middle-aged. So like, 25, 30s, and up to like 50, 60s. And I told them it doesn't matter what age group I'm seeing. I love geriatric, but I love all people. And they asked me, what would I do if a patient was upset? And, of course, the patient comes first. You want to keep the patient calm. You want to reassure them that you're doing everything you can to resolve the situation. And I told them if a situation ever got out of hand and I didn't feel like I could handle it, of course I'm going to go to the higher ups. Of course I'm going to get the right personnel to help me deal with the situation. I'm not going to get nasty. I'm not going to try to take the matters into my own hand and do something completely out of character. And she also asked me, if I feel comfortable learning new procedures. And I was like, of course. Like, as soon as they mentioned the EKG machine, I was like, what? I'm going to be able to hook up EKGs? Like, that's so exciting. Because the only time I ever did that was in nursing school on the mannequin when we had the simulation lab. We also have an x-ray room there. The nurses do not do any phlebotomy. We have the certified lab technicians there. So they'll be drawing all of the blood. We have a machine that when someone comes in for a UA, which is a urinalysis, they'll pee in the cup. We place, I don't know if we dip the stick and place it in the machine or just use like a dropper to use some of the urine and put it in the machine and it runs the testing, but it'll test for all sorts of things. So that's exciting. I'm just really excited to get my foot in the door with this company because this company has their own college. I don't know if I should say it or not. I don't really want to give away where I'm at, but I really want to. But they have their own college, and it's the college I wanted to go to for my bachelor's. And I don't know. I don't really know if I want to get my bachelor's because I've had so many good experiences as an LPN already, and the nurse that interviewed me with the director of both offices, I actually told her my predicament, like, do I really want to go back for my bachelor's and get into all of that debt, or should I just stay an LPN because I love being an LPN? You can do so many things as an LPN. And she was like, I was in that exact predicament, and I think I'm just going to stay an LPN. And I was like, I really think I am too. Like, I don't need to make $30, $40 an hour to be happy. And when Human Resources called me today and told me my starting pay rate, that was perfectly fine with me. A little bit more money is always better, but my boyfriend lives with me now. He's paying, half my bills, and I've learned to manage my money and live inside my means, so I don't need to make buku amounts of money. You know what I mean? As long as I'm utilizing the skills that I acquired in nursing school and I'm paying for that degree on these student loans, and I'm just helping people live a healthier lifestyle and making sure that their health is in check, that's really what matters. I became a nurse because I care about people. I want to help people live their healthiest life and make good choices. I didn't become a nurse to become a millionaire. I didn't become a nurse to feel like I overpower people. I became a nurse because I legitimately care about people and I want to help them live a healthy lifestyle and take care of themselves. People get diagnosed with diseases all the time that they didn't ask for or that they can't control. And it's up to a nurse to help educate them on that disease, educate them on the medications they're on, why it's important to take that medication. And that's what excites me about healthcare. I love helping people manage their health. So I'm really excited to see what type of patients come in and through the door. The practice was really huge. All the nurses I met seemed really warm and welcoming. and I'm just excited to start my new journey on April 30th. And it kind of works out because I haven't moved into my father's yet, as you guys can see because of the purple wall behind me. But this will give me time to really get all of my stuff packed, move to my dad's, get settled, get all of my, power bill transferred, all of that. And then I'm starting a new job pretty much the 1st of May. April 30th, when I start, I have to do virtual orientation on the computer. They pay me for the 4 hours. And then the second day, I actually go to a hospital and train at the hospital in case I get transferred over there or float, do whatever they tell me to do over there. And then the third day, I finally go to the doctor's office where I will be working. So the interview went great. I am very excited that I got it. I didn't really know if I would get it or not, just because this company likes to have their grads work for them for a certain amount of time. So I really think that anybody out there that wants a job, go for it. Even if you don't have the experience, I would say, just apply and tell them the truth. If you don't have experience doing this, if you don't have trach experience, or you're terrible at peg tube or G tube, tell them. A lot of jobs are going to retrain you how they want you anyways, so if they can retrain you and check you off in competency to make sure that you're comfortable doing that before you start working with patients like that, that's perfectly fine. I applied to a home health position where a lot of their, I applied at the home health positions, and they had a lot of trach and G-tube patients, and I straight up told them on the phone interview, I haven't had any of that experience since nursing school, because right out of nursing school I got hired at the OBGYN office, and then I went to work at the plasma center. So I didn't have any of that experience, and they're like, oh, well, we provide training for you, and we'll have you with a seasoned nurse. She'll check you off, make sure that you're comfortable with it before we just stick you with a patient. So no matter where you want to go in nursing, they're going to train you, and that's the best thing about it. And even though you're a nurse, you're always going to learn something new every day, and that's another thing I'm excited about in this practice that I'll be working for. We're going to see a lot of different things, and it's kind of just like the OBGYN where when people come in for their visit, I always update their medications. We have to do that. I have to look in the inbox and approve orders or refills for their prescription that the pharmacies send over. So it's already kind of a little bit of things that I knew how to do at my previous job, but it's a different program. And she said learning the computer-based aspect of it would be the hardest thing, which is usually true. There's a couple people commenting, so I just wanted to look. Thank you for congratulating me. Well, His Young Queen, first of all, congratulations on finishing your prerequisites. Good luck with LPN school. I'm here for you if you need any type of advice or help with anything. Second of all, this company usually does actually help with tuition reimbursement, and they want their nurses to go back to school to get their bachelor's. And I told them that, right in the room when they were interviewing me, and they were like, where do you see yourself in 5 years? And I'm like, typically, I would love to have my bachelor's degree. That is where I've always wanted to be. I've always wanted to have my BSN. And that's when we kind of got into the conversation of how, do we really want the debt? Do we really want to go back and stress ourselves out? But, I'm gonna work here, and it seems like a great place to work already, which is what excites me. Nobody had an attitude. One of the nurses came out of her room, and when she introduced herself and the lady interviewing me introduced me to her, instead of shaking my hand, she hugged me. She was like, oh, it's so nice to meet you. And I was like, wow, that was like the warmest welcome I've ever had. It was really awesome. So it seems like a great environment. There's benefits that they offer, like healthcare, 401k, all of that. So I'll definitely be jumping on that bandwagon. And, this might be my niche. This might be where I get in, where I fit in, I might really love it here. Yes, I loved working in OBGYN because I got to help bring babies into the world and make sure that people had women's health. It was so important. I'm taking care of their babies in the womb. I'm making sure that they are losing the weight they need to lose. Or if they had gestational diabetes, I'm making sure they're keeping track of their log and all that good stuff. And I built a good rapport with those patients. The plasma center, even though I wasn't doing hands-on care to these patients, I was still building a good rapport with them. They knew they could joke around with me. I was like the chill, laid-back nurse. And even today, like, I was myself, just like I am now. Like, I think they got the vibe that this girl is, hard worker. She likes to get things done. She's serious, but not too serious. Like, I know when to be serious, and I know when I can play around. And as patients were walking in the door, some of the nurses would be like, oh, here comes trouble, or what's up, homie? Like, everyone just was playing around with their patients, and I love that. Like, that's the type of relationship I love having with my patients. I always want my patients to feel like they could tell me anything in the world and not be judged, not be embarrassed. Because some patients, when they come to the doctor's office, especially geriatric, because they're older and they may have lost their husband or wife or don't have family taking care of them, you are the only person that people can vent to sometimes. So when they start talking about things, even if it's random, or even if they're just chatty Cathy and just like me, talking about everything and just rambling, that might be like therapeutic for them. They might be feeling wanted. They might be feeling loved just because you're listening to them. And I always thoroughly listen to people, even if I don't really have an interest in what they're talking about. But even if you're just nodding your head and saying, yeah, okay, yeah, just making them feel like their voice matters is making their day. And that's what a nurse is there for. You're there to help treat people. You're there to help people feel better and make sure that they are wanted. Everybody should feel wanted and cared for. That is your duty as a nurse. Besides, complying with all your rules and regulations at your job. But that's enough of that. I just wanted to update you guys. And of course, once my training starts and I learn my initial duties and start actually doing cool things at work, like setting up EKGs and stuff, I'm going to be like vlogging that for you guys. I'll be telling you guys all about that. But I'm really excited. Today was a good Monday, which is rare. But I start my new job April 30th, and I'm very excited for this new journey and opportunity. And I wanted to update all you guys, and I thank all of you guys for your support. Telephone operator. Yeah, and it doesn't even matter, like, what department you work in, for a doctor's office, for a hospital, even customer service at Walmart. When you work with people, you need to make the people feel like they are wanted and cared for. Nothing drives me more crazy than, going to the grocery store and the cashier doesn't even say, hey, did you find everything okay? Or how are you today? Even if you don't care how I am, still ask. Like, if you don't like people, don't work with people or around people. Be an at-home blogger or do something not with people. And that's kind of why when people call me crazy when I'm at work, I'm not crazy. I'm just bubbly and I'm outgoing and I love people. And being a nurse, it's important to really show that you love your job. And I do my best to try and leave stuff at home and leave work at work. And, there are times when you are stressed out. There were days when I was working and I would be a lot more quiet than others. But when people would ask what's wrong, I'm like, oh, I'm okay, just tired. I wouldn't tell them all this juicy gossip happening behind closed doors at my house. Or, even when my father passed away, I took that week off to plan everything for him. And then I was back at work that Monday. And the majority of donors, some of my coworkers didn't even know what happened because I was acting as normal as possible. And then certain things would trigger me to tear up or cry or stop talking and shut out, like, act weird. And they would be like, what's wrong with you? And then I would tell them in private what happened. And they're like, oh my gosh, I didn't even know. So it's always important to keep work at work and home at home. Sometimes you can't help it if you have a close coworker that you can vent to in private, or even if you have to go to the restroom and cry your eyes out. I did that the first month at work, especially when triggers happened. You just have to do that. You have to take care of yourself. being a nurse, you're so caught up in taking care of others that sometimes you put yourself on the back burner. But that's why I've told you guys before, I set aside a day or two a week where I put on a face mask, or I soak my feet in my little foot spa thing with Epsom salts. I do things to treat myself because nurses work hard. Everybody works hard. And you should always take care of yourself. Even though primarily you're taking care of others, if you're not there to take care of them, who will? You know? Yeah, there's other nurses and stuff, but you know what I mean. You have to take care of you in order to take care of others. So don't be scared to put yourself first sometimes. There's nothing wrong with that. Especially at home, even if you just need 30 minutes to an hour by yourself to read a book. I have a candle lit right now. That's how I relax. Even though I'm not stressed out right now because I'm not working, but you know, I light the candle and I'm watching Forrest Gump in the background, you know, just and talking to you guys. That's relaxation for me. I'll blog, I'll read a little bit of books I have, or I have those adult coloring books I color now. That has been very therapeutic for me. With the coloring, blogging, and writing in my journal since my father's passing, I'm starting to come around more. I'm starting to act more normal. So make sure you take care of yourself at the end of the day. That's a whole nother video though. Just like I said, Chatty Cathy, I love to talk. So wanted to update you guys. I do start my new job April 30th. Thank you guys for all of your support. Congrats to everyone who has graduated nursing school, is graduating nursing school. If you're in nursing school, keep pushing through it. I know it's going to seem like the end is never near, but it is so close. Keep pushing. Do not give up. Thank you so much. Keep going, keep pushing. Nursing school isn't for everybody. Everybody would be a nurse if it was easy. All of the blood, sweat, tears, hair pulling, screaming, breaking of pencils and markers, you know, it's worth it. Keep going through it. I'm here if you guys have any questions. If you have any video requests, you guys know you can talk to me. And I'll update you guys as soon as I start my new job. And I might start vlogging like my weight loss journey because I've gained a lot of weight lately. I've just been so emotionally stressed. I don't know. But let me know if you guys have any questions or comments or video requests. And I hope you guys had a great Monday. You're welcome. You guys know I share everything with you guys. I'm an open book. So I hope you guys have a great night, and I'll make a new video for you guys soon.